to everyone. I appreciate your willingness, and we look forward to presenting this information on beyond use dates of compounded preparations. And we want to encourage questions throughout. If you think of a question throughout the presentation today, please jot it down and submit it as we go along, because there'll be a lot of time at the end, or there'll be allotted time at the end for questions. So I really encourage you to submit your questions. And there's no question you can't ask. Feel free to ask any question, and we look forward to seeing if we can. If we can't get you the answer now, we'll get back to you with the answer. I declare a conflict of interest, real or apparent, and financial interest in any company, product, or service mentioned in this program, including grants, employments, gifts, stocks, holdings, and honoraria. This presentation is accredited through ACPE, the American College of Apothecary. The objectives of today's talk and discussion is at the end of the conclusion of this presentation, the participants should be able to explain the differences between stability, instability, and compatibility. We'll be looking at beyond use date and defining it, as well as stability studies. Essentially, we're looking at the shelf life and explaining that and the definitions. And we're going to compare and contrast. We typically, one would think of a stability study or shelf life study or beyond use study to be on a sterile product, but it also could be conducted on a non-sterile product, such as tablets or capsules or a topical cream. And we're going to also discuss some factors that might affect the stability of that compounded product, as well two other issues. We're going to add what is a typical stability study might compose of, as well as some of the regulation bodies indication. There's a lot of interest in beyond use dating and a lot of citations that's occurring through the inspections, and so we're putting some of the chapter verse references for some of the information regarding what a stability study should include. And the first objective, we'll be looking at the differences between stability or instability and incompatibility. This is really taken directly from USP 1191. I think this is one of the better definitions for shelf life or stability. It's really how long or a product, what's the extent that a product retains within its specified limits and throughout its period of storage and use the same properties and characteristics that it possessed at the time of the compounding. And I wanted to bring out, it needs to retain those properties throughout its storage period, and it's not just the chemical properties, but physical properties and others. What do we mean by instability? And I also note at the bottom of the slide, I tried to present the original or the reference at which the definition, so you could go back to the citation if possible. But the definition for instability is that chemical reactions are incessant or irreversible, and they're different than chemical entities of degradation products. And what we're saying is that they can be both therapeutically inactive and also possibly exhibit even a greater toxicity. And I'll discuss this more when we talk about some of the various factors, such as toxicity, in some of the factors that affect stability toward the end of the talk. Okay, what is incompatibility? And when we're saying incompatibility, we're talking about the substance, the inability of that substance to maintain its identity or to exercise properties when brought in contact with or into the sphere of influence of another substance. And we're talking about whether it be physical, chemical, or physiological. And examples of these incompatibility is like the Y-site studies. Larry Trissell has published the Handbook of Injectable Drugs, which has a lot of data in there on compatibility. An example in a hospital setting, when two IVs may be administered simultaneously, it's important to ensure that they are compatible with each other to avoid either a formation of a gas, a haze, or even a precipitation. And we know the importance and the detriment of a particle that could be introduced into an individual or a patient. So I think incompatibility is an important issue also to look, and that's why we wanted to stress the importance of really incompatibility, instability, and stability. The criteria should be tempered with also professional judgment, but this is taken directly from Larry Trissel's Handbook on Injectable Drugs. I wanted to give you some examples of some incompatibilities, and so these are some slides where the tests were conducted, and you can see both where gas is evolved. You're looking for gas evolution, a particulate matter being formed, and even turbidity. And in each of these, the order is important. When you're doing a study drug or trying to compare and look at the compatibility between two different drugs, the order of mixing may be an issue. And you can see we picked out some examples where you would first put A into B versus B into A. I think it's really important to know that concentration and or order of mixing can have an effect on a formulation or a pharmaceutical aspect of two substances being administered simultaneously. And these are examples of turbidity, particulate matter, and gas evolution demonstrating an incompatibility. This is an article that was published by Larry Trissel and Craig and myself, and it's on a compatibility of palidoxatron. It's a frequently cited, and it gives you a good indication of how a compatibility study might be conducted. And as Amy stated earlier, Ms. Dean, she indicated that several of the articles are given to you. So each of the articles that's being presented today in this webinar are provided for you that you'll feel free to print out in the attachments as a PDF. Okay, let's look at the beyond use date or stability study, and really the shelf life of it and some of the definitions. I did want to point out that routine potency is different than beyond use dating. Potency really is used for release testing, or it's a general quality attributes, whereas beyond use date, stability, that's really for shelf life. And the intention of the focus of today's discussion in this webinar is to look at extending the beyond use date or the shelf life of a compounded preparation, and not to be confused with potency, which is an important quality attribute that you need to use often in release testing. So USP 795, we know in USP that's the non-sterile, whereas in 797 is the sterile. And I wanted to bring the definition out from each chapter, and it's a pretty simple definition of the date which a compounded preparation should not be used. And it's determined from the date the preparation is compounded. And I think that's an important part I wanted to bring out, that when you measure it, the study should be conducted from the date that is prepared through the time at which the test or the study is being performed. And so this is the definition according to 795. Okay, the beyond use date terminology. Frequently, shelf life, beyond use date, stability, it may be or may not be used interchangeably. Typically, expiration date is applied and referred to as a manufactured product. But in compounding preparations, they'll often call that the beyond use date, which is similar. I wanted to say that the beyond use date for compounded preparations, they should be drug specific. It should be scientifically valid research studies when possible. And there's some guidelines that when used, you may use general guidelines when specific information is unavailable. And compounders, though, just from a terminology perspective, will use the term more frequently, beyond use date, where you might hear, well, what is the expiration date of that product or preparation? And that, again, is similar in that manufacturers will often refer to it as the expiration date. It's often the stability studies or expiration date is conducted by the innovator of the manufactured product, and it is very stringent. They're based upon multiple scientific valid products. It's a very strict, it's specific, and it's also, I wanted to bring up, container closure is important. Container closure, formulation specific is an important issue that we'll be discussing throughout the webinar today. But this slide is really just talking about the terminology in itself in this context. Okay, we're also going to be looking at sterile and non-sterile. Sterile preparations, of course, beyond use staging is really based upon chemical stability in conjunction with microbial or microbiological sterility, and that's whichever is shorter. So that's an important issue, that you might have a substance that is chemically stable for a longer period, but yet for some reason, due to an integrity a breach or some other issue of lack of a preservative, but you need to consider a microbial, whichever is the shorter the stability, that is the shelf life based upon all those factors. And then when looking at a non-sterile preparation, such as a topical or a cream or a tablet or a capsule, that chemical stability of the drug in the formulation and packaging at specific storage conditions, or again, the microbial limits. And you'll notice when we compare and contrast on subsequent slides, we try to bring that out in red. But essentially from this slide, the sterility is conducted using a sterile product when doing a beyond use date study or stability study, whereas in a non-sterile preparation, we're using microbial limits. And we'll talk about that here in a bit. And again, both of these are whichever is the shorter. Okay, USP 797, this is listed in 797, and what it's saying here, this is a chart that's listing the 3 risk levels. I know there's a proposal for 797, but as of today, this is what we're going by for USP, since that's what's being listed. But there's a team of experts and good people that's putting together, they're answering a lot of questions and working on the new 797. But essentially, this chart is talking about, I think the logic of this chart is saying the greater the risk, you want to do a risk assessment of your sterile product. And this is saying in the absence of passing a sterility, if you have a low risk, it may be good for 48 hours under refrigerated conditions for 14 days. Where you have a high risk, you can see it's only good for 24 hours in 3 days. So this is giving you the greater the risk, the less time it can be exposed to ambient or higher temperatures, which is more common sense. Sometimes that's not always so common, but in reality, that's the logic I think they're saying. You know, I do encourage you questions because we have a team of experts standing by, so if there's any questions on any of these slides, please feel free to post your questions. Okay, what are some methods to extend that beyond use date? Stability studies may be published in the literature. It's preferred that they're peer-reviewed. Stability or compatibility study conducted on your preparation using your container closure is the most scientifically valid and most stringent. And I think that's what, as you see regulatory bodies doing the inspections, they're looking for this type of study. Manufacturers will conduct the stability, and they will list that expiration date on the label of a manufactured product. Also, physiochemical properties of the ingredients should be considered when extending the beyond use date. Look at the general chapters and USP monographs. USP is publishing actually quite a few of compounded monographs with the stability data, and that have actually been performed. Extrapolation of the above should be based upon professional judgment as always. Okay, we talked about this earlier. What is stability? Again, it's the extent to which that product retains throughout its period of storage or use the same properties that it possessed at the time of compounding. So essentially, how long is that product could be used for or is safe and effective, and it's based upon a series of tests. And as we're discussing today, chemical or sterile, one should also consider other variables such as physical and other attributes, which we'll be discussing. Okay, this is exactly what we're talking about. This is taking from the 1191 stability considerations in dispensing practice, USP 1191. We typically look at the chemical or the physical attributes or the microbiological attributes of a product or preparation would determine the stability or shelf life. But there are two other considerations that many times is not mentioned or discussed, and that's toxicological or therapeutic. And these are more clinical. So that is an important part of stability as well. So the toxicological, as it stated, is if there's a byproduct. We know that there's some lactane byproducts of perhaps gabapentin or other aspects or other drugs, that one would want to consider that if a drug is decomposed or is degraded to a toxic byproduct, that's the purpose of measuring some of the impurities. Also, the therapeutic. It's important that the therapeutic effect remains unchanged throughout the life of that product. And so I really just wanted to, I put those in blue because those were some things that we typically think more of chemical or physical or the micro aspect, and those two may be ignored, but those are considerations. And this is taken, again, directly from USP 1191. So let's compare and contrast really the stability criteria for sterile and non-sterile preparations. Some tests that may be involved in stability studies would be the assay, and that's really taken from the Chromatography Chapter 621. And so it's imperative to use a stability indicating method when conducting a stability. A stability indicating method may or may not be used for potency, but a potency method may not be used as a stability indicating unless it has went through a stress and demonstrated that you can separate out the degradant or other impurities from the active. And I'll give some examples and discuss that later on as well. Sterility testing for parenterals or injectables or sterile products. Again, endotoxin testing might be a test involved pH. We'll talk, pH can affect the degradation. So pH is a very important test also in stability studies. What we wanted to do is when we talked about the test, I wanted to put the chapter from USP that refers to the test. And then a visual inspection is a very important. I can recall I give a citation where we did a morphine study, and the morphine over time had turned yellow, and so that is something that was investigated and reported. But yet the chemical change of concentration did not change. So there are several tests that are actually involved or important in a stability study. Again, particulate matter, that's listed in 788, the preservative effectiveness, the actual quantitation of the preservative. We're seeing more as there is more interest, and as the compounded industry is becoming more robust, and there's more interest in quality, as there's more regulatory oversight and direction, and even looking at the 503Bs, you see a general movement toward more of these other types of tests, as we're mentioning here today. Microbial limits, again, the absence of specified organisms such as 62. And I'll go through some of these specific things in general. This is a good slide, and now I wanted to point out the differences between some of the tests that you might conduct in a sterile preparation versus a non-sterile. Yes, we know that you're going to conduct a sterility test in a sterile product and an endotoxin test. You might even be wanting to quantitate chemically the preservative effectiveness or through USP 341 or do the assay, and again, the particulate matter. But notice in a non-sterile product, you might want to use the USP 51, which is really the ability to measure, the ability to keep bugs from growing in your product is another way. And I'll give a little bit more complex. But preservative effectiveness is an important test that should be considered if you have that is used in non-sterile products as well as sterile products. Okay, the 621, the HPLC stability indicating assay, what is it? That assay is capable of really separating out the degradants from the analytes. And this is important. Why is it important? You want to be able to accurately quantitate the analyte of interest without interfering of a degradant or impurities are known. And it's very important to realize it should be formulation specific. Here, the next few slides, we present excerpts from ICH, USP, FDA, and guidance documents regarding specificity. The regulatory bodies require stress testing, and here we present those excerpts. And I wanted to give sort of chapter verse from the location. But the other thing I want us to remember is that here it's talking about sample. This should include samples stored under relevant stress conditions. When they're saying sample, they're talking about specific formulations. So you might interchange that. They're saying, so this includes, specificity should include specific formulations stored under the relevant conditions such as light, heat, humidity, and acid-base hydrolysis, as well as oxidation. And this is taken directly from the Q2, which is, ICH is the a standard for a quality standard. The USP Chapter 1225, and it's taken directly from what we wanted to talk about here is it should include samples or, again, sample-specific or specific formulation under stress conditions. And without beating this horse, the point here was to show you through various regulatory bodies such as ICH, that's the International Committee on Harmonization for Quality Standards, USP, FDA guidance documents, and I even talked about the CDER, the Center for Disease, that we'll talk about, excuse me, I said Center for Disease, the Center for Drug Evaluation and Research. But these are some of the chapter verses references for indicating the need for stress testing and formulation specific on your samples. Here's the FDA guidance for industry. In the top header of each of these 3, 4, 5 slides is the source document in which I took the quote from. And I pulled out the quote and then indicated it from the source. This stress studies must be conducted on the specific formulation as not just the API or the active pharmaceutical ingredient or the drug substance. It's important to do the formulation. And so I'm just pointing out, again, the need for the stress studies. This is one guidance document. Here's another guidance document indicating for the industry stability testing of drug substances in drug products. Again, the formulation or drug products need to be stressed, not only the drug substance. And I wanted to say that stress testing helps to determine the intrinsic stability characteristics. And often I'm asked that question, why do that acid, base, or heat, or peroxide? Not only for the developing and validating your HPLC stability indicating method, but you want to know the intrinsic or the pathways that might be potential degradation. So, for instance, if you have an IV solution and it's hanging in a window at a hospital and the sunlight hits it, you may know there could be some potential degradation byproducts. I think nicardipine, there's some history and data literature on that. But we know that it's not uncommon for some drugs to degrade it, the intent for the container closure in an amber or darker vial. So the stability is a very important quality attribute for compounded preparations to be considered. And I think you're seeing a lot of attention to that over the last few years. And then this, again, is taken from the CDER, that Center for Drug Evaluation. This is just another documentation talking about having no interference, being well resolved, and talking about stress studies. And I wanted to give the chapter verse for it. What does an actual stability indicating method include? It includes a specificity, meaning you're stressing your drug formulation, also the placebo or the excipients in that acid, base, heat, peroxide, and UV to show that there's not an interference. It needs to include system suitability. This system suitability, which is the resolution or telling, these are some parameters, relative standard deviation, column efficiency, are parameters, which actually should be done also in every test. And regardless if it's a stability indicating method or potency, you should be running standards which are set up clearly in USP prior to and FDA guidance documents for any analytical method. But also it's important to show the linearity, the precision, the accuracy, and in addition, look at the ruggedness or robustness, and then you need to know how low that limit of detection or quantitation. And we know that as we're moving into an era of more biologics or large molecules such as proteins and peptides, it might be important to do a freeze thaw. So that would entail freezing and thawing through several times to mimic what the sample or the preparation would actually be happening in real time. And it's important that one question might be is how often or how long. You want your conditions to mimic as much as possible what is happening in real life. So if it's stored in a refrigerator conditions, you want to conduct your stability study under those refrigerated conditions if it's stored for a long time. And so it's not uncommon to have several sets of conditions, 1, 2, or 3 sets of conditions at ambient conditions or even accelerated conditions. Here's an example that's you've seen this. We've presented this on several other occasions, but the upper left one, that figure 1, is really showing a HPLC of just a single product that you're looking at it from a potency. That really evaluates a single analyte in solution, and when you're HPLC, you might see one peak with no interfering substances. But let's say there is a degradant. If you run it without running a method, and that's the purpose of the method development, is to be able to segregate and separate a degradant or another impurity from the analyte of interest. And so we wanted to show here that series from where you really can't adequately resolve the analyte from the degradant from figure 2. And then as you tweak your method, you might continue to resolve those peaks that are able to accurately quantitate that analyte from the degradant, but it's still not sufficient. You need baseline resolution. So really an optimal chromatogram or optimal stability indicating method would be demonstrated in figure 4, which is you're able to see the analyte on the right side, you're able to see the degradant, you're seeing there's no interferences, you can accurately quantitate the area under the curve for that, and you're able to show and demonstrate that there's no issues of interference. So let's look at the sterility test. What is that? It's, of course, is to test or detect the microbial contamination and to ensure that those injectables are free of microbes. This is information that's presented before, but you know a sterility test in Chapter 71 are designed to test a broad range of contaminating microorganisms, such as aerobes or anaerobes, spore-forming bacteria, as well as fungi and yeast and molds. The test preparations are reserved. The way the test is actually conducted, what I wanted to do is tell what the test is or demonstrate or communicate the test in this webinar, and then just tell a little bit how that test is conducted, or even maybe an acceptance criteria. A sterile really means simply no growth is released when it indicates that the product being examined meets the test requirement for sterility. This is taken directly from USP 71, and it's an observation for microscopic evidence of microbial growth at the end of that incubation period. And we know 14 days, but if there is a suspect, you may need to streak it out and continue on, and so the 18 days. Endotoxin. What is an endotoxin? Endotoxin, we know, is from the gram-negative bacteria. Endotoxins is not removed from sterilization, and so it can create a pyrogenic response. It previously was known as a pyrogen or a heat-causing reaction. It represents the safe amount. Conservatively, the endotoxin limit represents the amount that the endotoxin is allowed in a dose of a specific medication. The monograph for each individual endotoxin or individual drug lists that limit, and a specific drug in the units EUs per mg or EUs per mil. And those endotoxin limits can be calculated, and they're very route specific. And this information is taken directly from Ken Latta with permission, Compounding Pharmacies and Bacterial Endotoxin Test. pH. Why is it important? Of course, we know pH is parts of hydrogen or amount of proteins in that solution, and really the pH can contribute to the degradant of that product and thus changing that beyond use state. So if you have a substance or a preparation or an IV solution or injectable or parenteral and the pH is off, it could accelerate the degradation and decrease the stability or shelf life or expiration date of that particular preparation or product. It's important to do a visual inspection. We talk about visual inspections here of the final product, color, homogeneity, the presence of a foreign material, or any observed particulate. You know, we'll talk about particulate matters here in a bit, but over the last few years, there's been a lot of attention paid toward a product that was used in Avastin syringes where we found that it was reacting with the oil and the silicone, and you would get some precipitant forming in that. And I think that that's a very important. Again, I wanted to encourage questions if you have throughout this. This is a paper that was published on the stability of a mixture of morphine, bupivacaine, and clonidine in an implantable infusion pump back a few years ago. And that particular one is an example where it passed chemically and microbial. However, when it exposed to the body at 37 degrees, it discolored. And we went back in the data, and I remember talking to Larry Trissel, and he said, yeah, Tom, I think there is some data out there that shows that. Well, sure enough, back in the 60s, there was a reference to morphine turning yellow. So it's important, all these tests, and we want to give examples of what the tests are and why they may be important. And this is one specific example that was documented, and it was previously documented in the literature. Particulate matter, that's a very important issue. Particulate matter consists of substances such as dust, glass, precipitants, as we just mentioned, and those are performed according to the USP 788 and 789. And this is a reference by Akers that is a good reference for particulate matter. And I believe that there is an article also on this that was published. The particulate matter injections in 788 is talking about the solutions for injection, and the route is important. And then also 789. This, again, it's used to determine the number of particles. I don't want to get into too much detail, but there's basically two methods at which a particulate matter test could be performed. The standard light obscuration, which is really used for the most of the samples, but another method could be a microscopic method, and the USP chapters allow for both, and particularly in such as emulsions or viscous substances or substances that have reduced clarity. I think that microscopic method is a suitable method as well. This is the article that we published for particulate matter in injections, and that's also provided for you today. Preservative effectiveness. Really, this test displays the ability of the preservative to both kill the microbes and prevent the growth. We have a lot of questions, and I think there's also an article provided for you on 51.
Sorry about that. We had a technical difficulty, but now we're back on, and give us just 1 second. We're going to switch the screen here.
Amy, you want to go back in there?
Give us just 1 second. We'll get back on track here. Thank you for your patience. Okay. Dr. Cupid, go ahead.
Okay. The preservative effectiveness, sorry about that, you guys, we appreciate that. Thank you, Ms. Dean, for correcting this technical issue. the test really displays the ability of the preservative to both kill the microbe and prevent that growth. The antimicrobial effectiveness, really, there are really 4 product categories in 51 that determines the acceptance criteria, and these are based upon the route of administration and the product type. And this is an article that's published for 51 for you. Okay, preservative quantitation. Because another method for testing the preservative quantitation is a chemical quantitation, and that allows you to actually test the concentration of the preservative through a chemical method or a chromatographic method. Okay, are we okay, Ms. Dean? Okay. Okay, you want to try to, you mean to call back in, are we okay? Okay. USP 61. Really, this is, I call it bioburden, and it's the microbial limit. It's really the total TAMC, which stands for the total aerobic microbial counts, or the total yeast and mold count. USP 61 is an important test, and it's important to remember that you need both to conduct method suitability and growth promotion when conducting a USP 61. Here's an article that was published by Dr. Vu on microbial limits. This is just a recent article there's actually broken up into 2 parts, but I think it's a good article for microbial limits that's talking about for non-sterile products. And we were talking about earlier the importance of using 61 in a non-sterile preparation when conducting a stability study. Okay, the USP 62 is really the absence of specific objectionable organisms. For example, you don't want E. coli in a tablet or a capsule or staph in a topical cream. And so one would talk, and you might want to look at that examination for a non-sterile product. And those are examples of what it is, the test, and why you would conduct that test. I also want to point out it's important when running a method 62 or an absence of the objectionable organisms to do both a method suitability and, again, growth promotion. And there's another article that's brought for you, presented and given to you as a PDF at the end of this webinar. This is an example of the stability study protocol. Many times when people will ask, what is that? And so here's an example where methylcobalamin as an injectable, it's a multi-dose vial at 1,000 micrograms per ml. We know that the vial type was an amber vial. It is stored under 2 to 8 degrees or refrigerated conditions. They wanted a single analysis, and as you're moving into GMP or the 503B and they're looking at doing replicates or triplicates rather, they're looking at 1 lot. So you can design a stability study, and this is one study that is done, and the purpose is to show you the parameters or variables that would be included in a stability study. So here on this methylcobalamin injectable, you see appearances performed, pH, the assay itself, and that, again, that assay, that HPLC assay is a stability indicating method. We actually checked for the benzyl alcohol, which is a preservative. This was to demonstrate that the preservative was able to maintain or keep the bugs down throughout the life of the product, which is the importance of conducting some of these tests in a stability study or shelf life study. And of course, the sterility and the endotoxin or the antimicrobial effectiveness test. Notice those were tested at the beginning and at the end. And looking at these time points from a practical perspective, you'll want to work with whichever lab you choose to use. You'll want to look and talk with them because they can do an experimental design that can optimize those tests to get the maximum amount of information for the least cost and the most benefit for you as the compounder. but it's important to not lose sight of the quality or the integrity of the study. Okay, what are some factors that affect the stability of those compounded preparations? Really, we talk about the drug, the concentration, as we discussed earlier. The excipients and vehicle plays a very important role. We know through studies of oxytocin that whether you use the dextrose or lactated ringers could could decrease the shelf life of the oxytocin. So it's not uncommon for the IV to be in sterile water for injection or saline. But the excipient or the vehicle could affect that stability, and those need to be formulation specific for both the drug, the concentration, the vehicle, the excipient, and then it should not be ignored for the container closure. The storage conditions are very important as well. And some of the factors that actually affect that stability can be particle size, the pH, as we discussed earlier in today's discussion. The compatibility, the ionic strength. These are all listed for you in USP 1191. Extractables and leachables are an important issue. There's a lot of requests, a lot of interest in that container closure, and you can see what are extractables and leachables. Really, leachables are products that are leached into that drug product from the container itself, and then extractables are compounds that might be coming from the container closure when in contact with the solvent that's placed inside that container, and those are an important aspect to look at as well. But I just wanted to throw this slide into it. The conditions that affect that stability might be your temperature, the light, the humidity, oxygen, carbon dioxide, the packaging components. All these are listed for you. So in summary, we've talked about the beyond use date definitions. We've talked about various types of tests that are included, such as the stability indicating assay and the importance of the stress on the specific formulation, the tests that are used both for sterile and non-sterile preparations. And we've also talked about factors that affect that stability, which is important to consider the container closure as well as the dosage form and the conditions. We've included some references for you at the end of this, and then there's some chapters. So the last portion of this talk is the tables taken directly out of USP. And I want to thank you for your time today, and we now turn this over to Ms. Dean for questions.
Thank you all for sticking with us through that technical issue. We apologize about that. We're going to go ahead and get to the questions with our panel of experts here. And we'll start at the top.
Okay, when trying to extend the topical creams beyond 30 days, what would you need microbiological data since it's a non-sterile in the first place and not taken oral?
Microorganisms can still be a problem even if it's a topical, even if it's a topical route of administration. Going back to Dr. Kupik's assay or his discussion earlier, you wouldn't want staph in a topical cream. So you would want to establish the bioburden of that cream overall, and then you would also probably want to perform a USP 62 test to specifically look for staph in the preparation. You would want to make sure if you had a preservative in it that it was able to deal with any kind of contamination if it's a multi-dose situation. So you'd want to perform USP 51 as well.
Okay. The next question is the assay USP 621, which is the chromatography chapter, different from a standard potency test performed?
So yes, this is Vince Bob, I'm the laboratory director here at ARL. So 621 is a chromatography chapter. It's a general chapter. It deals with HPLC, GC, and TLC, and it's to be used in conjunction with specific methods related to monographs. So 621 in and of itself is not an actual methodology. It's just sort of some general guidelines that USP has around the methods. So in terms of is in 621 different from a standard potency test? They're sort of different things. 621 relates to potency testing, but it is not in and of itself a potency test.
The next question I think is also a good question. It says, don't you need to have a third-party verification for these tests in order to extend the beyond use date? I didn't think you could do it in-house. I think that if you have the ability and you have an HPLC and you have the personnel that's adequately trained, you have the equipment that's operating appropriately, and you understand the conditions, and you have the processes and knowledge, then it can be performed that. There's no one saying it has to be done in a lab. There are many pharmacies, as many manufacturers will have their own laboratories. So it's just that these are criteria that's set up by, as we have given multiple references, that you need to meet. So you'd have to have the appropriate equipment, you'd have to have the appropriate personnel, and the knowledge and understanding to do those tests for conducting beyond use dating. Okay. Can you provide information on the differences between a stability indicating method versus stability indicating assay? Can the latter be used for extension of a beyond use date of a non-sterile preparation? Okay, I think a stability indicating method or a stability indicating assay is, in my opinion, the same thing. When I say that term assay is really a test, it's not uncommon, whether it be in the clinical world or the pharmaceutical world or another assay, is that they're talking or often referred to as a test or a method. When trying to extend topical creams beyond 30 days, oh, you did that one? Okay. Down to, okay. Is a non-sterile preparation, in a non-sterile preparation, how does one consider the need to perform a microbial study of a prepared base that has studies performed on it already and the base has been marketed for specific use? I'm not sure I understand this question. Is there something we can check via C of A or information we can ask for from the base manufacturer? James, do you understand?
I think so.
And Matthew, if this question is not answered to your satisfaction, please email us and we'll try to answer it for you. James?
All right, yes, this is James. Read it real quick. Okay, I think what the question is trying to ask is, can you just take, first of all, should you ask for a C of A or some kind of documentation for it from a manufacturer if a base is made for a specific purpose? And then on top of that, what steps should you take to make sure that it is adequate for your use? You should definitely ask for C of A's and any documentation that a manufacturer can provide. In addition to that, whether they are able to or can or don't provide that documentation to you, you should certainly confirm and qualify your vendors and make sure the things that you buy from them meet the specifics of what quality level you need for your product. On top of that, even if the raw material is qualified and you've done your due diligence, after you've turned it into your final product, you should perform those tests again to make sure that during compounding, nothing's changed as far as a microbiological picture of the final product.
I think this is Brian, Business Director here at ARL. I think part of Matthew's question here also is probably related to the labeled expiration date on the cream, and so I think the important part to consider on that is that the manufacturer of the cream has done testing on the base cream. The compounder is then changing the base cream by adding a active pharmaceutical ingredient to the base cream, and so once that addition has occurred, then you need to take into consideration the stability of the drug that's been added to the base.
That's a very good response, Brian, and the interactions that could occur from that. The question is about the new California regulations. State 3 extension of the beyond use date is only allowable when supported by the following: method suitability test, container closure integrity test, and stability studies. My question is, aren't the first two specific to sterile only, and you don't do method suitability on CCIT on non-sterile, do you?
I'll take it.
Okay.
This is Brian again. So Yeah, you're correct. The method suitability is related to the sterility test. Is probably what they had in mind on the California regs. But if you remember in the talk, or maybe we got to it later, the 61s and 62s that are related to non-sterile preparations, they also have a method suit for those tests. So I think what the California intentions were there is make sure that your whether it's your sterility test or your 61 or your 62, that you've performed the method suitability for your test. The container closure integrity test, I would think that would be related to mostly for sterile preparations primarily. So I think that probably answers that question.
Okay. Given the cost-intensive nature of stability studies, do you foresee some sort of middle ground for compounders, that is, varying column characteristics to evaluate robustness, etc., that might better indicate stability beyond a simple potency test without requiring a full-blown stability study? Well, two things. One, as I mentioned several times, a potency test should not be used to establish stability in any way. But USP is conducting stability studies and has many of them, and they're in the process of printing and publishing these stability studies and monographs on common compounded preparations. So I would encourage you to contact USP or see the literature, but a lot of the compounded preparations, or excuse me, many of the compounded preparations have stability study data that are being published in a monograph by USP. But to answer that question, no, potency should not be used to in lieu of a stability study, or to be used to determine a stability study. Is there an acceptable degradation limit? Would you consider that preparation as stable? That's a very interesting question, because I can tell you that I've been in many talks on this issue, and in the pharmaceutical industry, Kathy, would you like to answer that, or do you have a thought? You can degrade so much that you're degrading the degradant. And I think that you really want to mimic what the conditions would be in real-life situations, and or be able to predict some potential degradants that might be in the manufacturing process, which is the purposes of the related substances. So I think the idea for the degradation limit is there are several citations and literature out there to indicate how far and how much specific for the degradation. And that's a frequently asked question. That's a good question. How do you prevent introducing contaminants with the tools you are using to conduct the test?
This is James again. Any of the tests you're going to perform, I'm assuming this is a microbiological question. Of course, any tools that were to be used in testing would be autoclaved. You'd be performing the test in some kind of controlled environment, a PEC, ISO 5 type hood, and that is going to prevent the introduction of contaminants along with proper aseptic technique throughout the procedure.
Are the objectionable organisms in USP valid for non-human veterinary preparations, or are there any other organisms that should be considered?
I'm not certain as far as which of the organisms there would be overlap from the ones specified in 62, but 62 actually, I'm sorry, USP 1111 is the informational guidance chapter on that, and I'll refer you to that. At the bottom of that chapter entry, it lists other factors, and they would include things like specifics of the patient. So as far as the veterinary medication would go, I would think you would be able to look at pathogens possible from a veterinary standpoint and modify your testing to screen for those pathogens. Okay, so a time point study is just one piece of a stability study. That is correct. I mean, there's multiple, as we demonstrated and we discussed at the end of the a typical protocol. If an excipient has a shorter beyond use date than an active ingredient,
what is the beyond use state, the lesser or the active? It's always the lesser. One cannot assign, and a good example would be analogous to the approach we took with microbial or chemical, whichever is the shortest beyond use state. You always want to use the most conservative estimate when establishing beyond use dating. So to confirm that there is a validated method used for 621, there is no need to further validate that method for stability indicating studies. Vince?
If it's validated per 621. So again, 621 doesn't talk, is not a specific methodology, and there are no associated characteristics with it. So if you're assuming that if someone's stating that a method has been validated and references 621, and it's already been demonstrated to be stability indicating for that specific formulation, there would be no need to go do it again.
However, what Vince stated in next to the last statement was assuming it's stability indicating. By a validated method using 621 doesn't necessarily mean it's stability indicating method. We went through quite a few slides discussing the stability indicating nature. So you can have a validated method that is not stability indicating method.
That's actually correct, and part of that is sometimes we get asked about USP methods in general. So the method that's listed in USP, can I just use that methodology for my stability study? And so that's the answer to that is sometimes. Some of the USP methods are actually stability indicating methods for those formulations that were submitted to USP for inclusion in the monograph. However, some of them are not, and you cannot tell just by looking at USP which ones those are. And so I always caution folks to make the assumption. It's going to be upon you to demonstrate to a regulator or FDA that you know that that method is in fact stability indicating. So you would not want to assume that just because a method is listed in USP that it's okay to use for a stability study.
Actually, we have a whole host of questions, and we've committed to one time point. So I'm going to take one question, and then what we're going to do is try to take all your questions, and the asker is listed. Amy, can we do that?
Sure. What we're going to do, we are close to time, and so we're going to take one more question, and then following this session, we are going to put together a full question and answer sheet. So that will have all of the questions that were submitted and the answers, and we will submit that out to all of the attendees. So you have a list of all the questions and the answers from the session, in addition to the recording of the session, if you'd like to share that with your staff as well.
Okay. Let me see. Okay. Usually the assay is a potency over time test by just testing time points of the active ingredient. That's by an individual asking, they just make a statement. But as we talked about earlier, potency over time is not an acceptable method for establishing beyond use dating.
It's all about the ability of the analytical method to separate any potential degradants of the API. So, so something to take in consideration. I mean, but whether you call it a potency over time or stability study, you need to, if the intention is to extend the use period of the preparation, you need to make sure that the method is stability indicating.
Thank you all for your time today, and we will follow up this session with the evaluation link in order to get your continuing education credit. Just a quick note, when you fill out the evaluation link, in order to get the continuing education credit, you do have to have your NABP number, your date of birth, which is just your month and date, and then also specify your role, which is either pharmacist, technician, or other. And then we will also include the question and answer sessions as well as the recording. Thank you very much for your time. Have a great day.